Hello, everyone, and welcome to another episode of the Wise Decision Maker Show, where we help you make the wisest and most profitable decisions. My name is Dr. Gleb Tsipursky. I'm the CEO of Disaster Avoidance Experts, the future of work consultancy that sponsors the Wise Decision Maker Show. And today with me is Dr. Kevin Wandler, who is the Chief Medical Officer of Advanced Recovery Systems. Dr. Kevin, could you tell us a little bit more about what Advanced Recovery Systems does?
Absolutely. Thank you for having me on your show. I appreciate it. Advanced Recovery Systems started about 10 years ago, and our dream was to have a recovery treatment program for individuals with addictions, of course, and co-occurring disorders, depression, anxiety, trauma, those sorts of things. But everyone that comes in most of our programs, have a primary substance use disorder. And so as a result of that, we do detoxification to get people safely off of medications, substances, illegal, and some of them are prescribed, of course. And we do residential care, which is part of it's kind of a step down from detox, where patients start learning all about the skills necessary for recovery. We also evaluate individuals, especially with opiates and with alcohol, to give them medications called medication-assisted therapy. These are medications that help decrease cravings for some, and for others, depending on the drug medication prescribed, it may also even prevent getting high, so helping break that cycle. And then we step down. What makes us unique, I think, is detox and res are pretty common throughout the United States in treatment programs, but we also offer housing for people with PHP, partial hospital, and it's called intensive outpatient. Those are the next two lower levels. And what that does, and we found in our data, and we get evaluated by insurance carriers, they give us report cards, right? That our patients, the longer they stay in a safe recovery environment, and those that need MAT and take it, the better their outcomes. We're trying to, and now, unfortunately, we've had a surge of this little nasty drug, fentanyl, and it's a killer. I mean, it's changed how we do business, and as a result of that little nasty bug drug, we really are really pushing medication-assisted therapy. Medications like buprenorphine, Suboxone is pretty common name. It's a brand name of buprenorphine, and so that people won't overdose. I mean, it's really it helps prevent that in the end, and it decreases cravings and lots of things. But and then we're not the end all. Then we work really hard on getting our patients to see a provider, hopefully within a week after leaving, and then doing follow-up care, of course. So yeah.
Excellent. And how should business leaders be thinking about these issues among their staff members? How should they be approaching them? What's the mindset with which you wish to convey?
Well, I think that anyone, I mean, technically, substance use disorders are a mental, part of the mental illness. There's a book that we utilize to code and help classify psychiatric disorders, and it's called DSM, Diagnostic Statisticians Manual. Number 5 is out, and it's in there along with depression, anxiety, etc. I think that what's happened for business owners, couple things. First of all, got so crazy with COVID, right? I mean, a lot of people had to work from home. That led to some isolation, even though they're working maybe on a Teams or some sort of a platform like this. It added to isolation, and I think as a result of COVID, it caused a lot of depression. A lot more mental illness came out, whether it's depression, anxiety, or substance use disorder. I mean, it's just gone trajectory. And so I think what business owners need to look at, first of all, is should they even do drug testing? I mean, that's where it starts, even before you're hired. Some of them require it, some certain types of businesses, and especially for employers, and they would know this, if they have government contracts, that they have to do some pre-employment drug testing.
Sure, of course.
And then, the other times you would even look at that would be pre-employment. And then if you're doing random drug testing, and then there's obviously if someone's in an accident, I mean, that's what we do. If one of our employees is on the job and they're in an accident, a car accident, for example, we would also, send them obviously to the ER to get us evaluated, but we'd also want a drug test. And then just suspicion of behavior of that looks, whatever that means, looks like it's someone's impaired. I mean, they're slurring their words, they're confused, et cetera, and I think those are some key areas. What's interesting, which has happened over the last really 10 years, is cannabis.
Yeah.
In the workplace. I mean, alcohol is one thing, and I'm not promoting alcohol by any means, but, if you drink alcohol, it metabolizes in men usually in an hour, one glass or a beer or a glass of wine or a shot of some hard alcohol. 1 hour, it's out of your system. Obviously, if you drink 5 beers, it takes longer, but one, it's gone. If you're a daily cannabis smoker, or user, and you live in a state, I mean, we have 21 states right now, including District of Columbia and Guam, that have legalized recreational cannabis.
Yep.
And you're going to be positive on your drug screen. It can be up to 30 days. So it's just something, to be aware of. When our patients come in that are positive for cannabis, we send it to the lab and we get a number, of how much cannabis is in their system. And we do random drug screens on our patients even, and we want to make sure that the cannabis number is going down. My hope is that if they stay with us long enough, usually about a month, it'll be 0, and that's great. It's also great for the patient to know your drug screen's clean, buddy, or it's negative for any drugs of abuse. Complicating that, though, is that there's a total of 37 states, so an additional 16 states that have medical cannabis laws. Yep. And as an addiction medicine physician and psychiatrist, well, no physician can prescribe cannabis. I mean, we can't do that. We in every state that has it legalized for medical cannabis. You have certain protocols, you have to meet certain criteria. And so the physician, all he or she does, they do is certify that John Doe has these problems, and it checks a box. And every state's a little bit different, but they are depression, anxiety, sleep, pain, different things like that are the common indications in different states of where that those other 16 states that don't have recreational cannabis. And in the other states, it's illegal. And it's a federally illegal. That's why physicians can't prescribe it. We can only say that you have depression, you have sleep issues based on your history. And then we can, if we so chose, we can, certainly fill out a card for them in those 16 states. But anyhow, it's an issue. And so if you use cannabis, like I said, it can stay in your system a long time. And it can affect your reaction time, your depth perception, coordination. A lot of federal programs have a 0 tolerance for cannabis. So you get a pre-employment drug screen, it's positive for cannabis, you won't get hired. And think of those areas where you need coordination, you need a good reaction time. I mean, it's pretty much DOT, Department of Transportation. So it's airline pilots. You don't really want them high, right? It's or intoxicated for that matter. It's people running heavy duty machinery, and forklift drivers, people that drive for a living, FedEx, etc. drivers, they can't be impaired, and so or you don't want them impaired.
But let's talk about businesses that have, let's say, staff like in marketing or HR or programmers. They don't need those reaction times, right? So what are you thinking about in terms of, let's say, recreational states where it's recreationally or medically approved? should businesses even be testing for cannabis in sectors where they don't have to care about the reaction time of their employees, where it's much more of a knowledge worker, creative, which might be, and I have no idea,
Right.
I'm not a user, but many people say that cannabis facilitates their creativity. So what are
Right.
you thinking of in terms of, is this even something that businesses should be worried about, or is this not something they should be worried about if they are not dealing with people for whom reaction time is an important issue?
Well, and you bring up a very good point. I mean, businesses are not required, except those that have, again, those government
Sure.
contracts, to do drug testing. And it's expensive. I mean, we do drug testing because the nature of our business, we're healthcare.
Of course.
And I believe majority of health, like hospitals, et cetera, do drug testing. So we have to pay for a pre-hire drug test and then random drug tests, et cetera, et cetera. And it's costly. And so a small business owner probably won't even bother doing that.
Hmm.
And they don't need to, you know. That being said, you also, again, that person who works from home, say, and is, more IT versus, out there driving, using
Yeah.
heavy machinery, et cetera. It may not be a concern. It may
Hmm.
not be a concern unless you start seeing a decline in their work, et cetera. And
Hmm.
most businesses, I mean, again, the small businesses don't, but larger ones, we have employee EAP programs to help people,
Yeah.
especially during COVID. A lot of people utilized it because a lot of people got sick and
Sure.
and started utilizing EAP much more. Even a lot of it's tele, just like we're doing right now. It's a tele session, and it can be very helpful. So it's a nice thing. We offer tele EAP services for our we don't do it, but we have it contracted out. I can't be the
Hmm.
provider of my staff, so
Sure.
so we contract that out. But yeah, it's not required by any means.
Hmm.
So yeah.
Well, that's a good nuance, and I think that clarifies things. As we come to the conclusion, what do you of our interview? What do you think is going to be the future of recovery? What are you seeing is going to be? What kind of improvements are going there? So, for example, a number of fields are being impacted by artificial intelligence. Is that part of the future of recovery? Maybe there are other things that you're seeing, maybe some medications that are on the horizon. What
Right.
are you seeing as the future of
Yeah, there's
recovery
some
for businesses?
excitement out there. Especially in the AI field,
Mhm.
artificial intelligence, or they're actually coming up with some. I mean, part of the treatment, in addition to detoxification, maybe medication usage, given to help for MAT, drugs like cocaine we don't have an MAT for cocaine right now,
Mm.
and amphetamines, we don't have it, and the hallucinogens and drugs like that. So the best treatments really are therapies, and there's a lot
Mm.
of manualized AI kind of therapies coming
Yeah.
out, and they've been very successful. And we're not utilizing them because I'm using old-fashioned humans to do therapy.
Mhm.
But I think early on that's really a better place.
Mhm.
And we have patients that don't live 30, 40 miles away. And that's a long way, especially in some of the major
Mhm.
metropolitan areas, to be able to get to a provider. So they can do a lot of things online, which is really nice. Some of our medications we still don't do online, because I would like a drug screen before I give you a shot, and obviously I
Yeah.
can't give you a shot through the computer. So
Sure.
that's part of it. I think the other area is they are looking at there's so much technology out now, and even we saw that with the antivirals. Well, they're looking at doing almost an antiviral for cocaine. They've
Ah.
been working on this for a while, that you get a shot, like a flu shot or a COVID shot, and you may be immune to some of the effects of cocaine.
Mm.
And for someone who's a heavy duty user, I mean, I don't need a shot like that, but for
Sure.
someone who's been trying to get off of cocaine, if it'd be like, then they use the cocaine and nothing happens.
Mhm.
So why spend your money, right? I mean,
Yeah.
if you're not going to get a buzz, what's the point?
Mm.
And if you're a cocaine user, so I see that as exciting. They've been working on that
Mhm.
for a while. Hasn't been too successful yet, but our technologies improve every year, and I think we'll have other medications. I was just doing some review articles, not for this talk, but for myself. And they're really coming up with some unique pharmacotherapeutic interventions for all these addictions. And I see that as really a good thing, you know.
Yeah.
Unfortunately, I'll just say that my big plug is that tragically, only about 10% of people with a substance use disorder reach out for help.
Oh.
And so, you know, really, with some of the, you know, Medicare, Medicaid, all cover this stuff in addition to regular insurance. And so for those people, you know, they should be able to get help. And I really, you know, would like them to get help. They can certainly reach out to us. We're only like in 7 states, but, you know, we certainly have resources throughout the nation for individuals, because we've been, you know, our patients come from all over the United States. They don't just come from Florida, where we have 3 facilities, or Georgia, where I'm at right today. You know, the Atlanta area. They come from all over the United States for care. And, you know, we try to have resources for them when they go home. To me, that's our part's key to save lives. And then the follow-up is also very important.
Yeah. Well, thank you very much. This was very helpful. Where can people learn more about your program, and which states are you present in? So can you name all the states?
Sure. So currently we're in Washington State, just in Vancouver, Washington area, just north of Portland. So it's both Oregon and Washington there. And then we are in, we have an outpatient clinic in Colorado Springs. And then we have an inpatient unit just south of there in a town called Plumber Lake, Colorado, just north of, it's just right there. Then we have facilities in Columbus, Ohio. We just opened up in Kansas City, Missouri. We have a facility in Atlanta, Georgia, where I'm at today, supporting my new staff. We have a specialty program in Maryland for firefighters. It's co-sponsored. I mean, there's no financial sponsorship. It's co-sponsored with IAFF, the International Association of Firefighters. So we're able to treat not only substance use disorder, but trauma. And they certainly, I mean, 9/11 just opened everyone's eyes to trauma for firefighters, you know, and others, of course, that were affected by 9/11. But I mean, they were in it, you know, trying to save lives. And it truly opened that whole area up. What amazing work they do. We're then 3 in Florida, 2 in the greater Orlando area, and then 1 down in West Palm Beach. And then we have an outpatient clinic in Miami. So we're spread out a little bit. And the best place to reach us is probably advancedrecoverysystems.com. You know, and they can see all about the work we do, and me when I had hair. I think my picture's old. So, before COVID, I had hair. We'll just say that.
I didn't know that was one of the side effects.
It's I'm just kidding. I'm just, you know, that was yeah. So
I get it.
You know, so that's how you get a hold of us. Advancedrecoverysystems.com, and we have people 24/7 that, you know, that answer the phone. It'll be on the website, and they can call in and get support, even if it's not for us. We want to help save lives. So again, our thing is we'll try to help get a program for them that may be in their area.
Excellent. Well, thank you. This was very helpful. Really appreciate your time.
Sure, no problem. I appreciate it. Thanks for reaching out.
And thank you to the audience for checking out another episode of the Wise Decision Maker Show. Please make sure to subscribe wherever you checked out the show and leave a review. It helps others discover the show, and it helps us improve the show. All right, everyone. I look forward to seeing you in the next episode of the Wise Decision Maker Show. And in the meantime, the wisest and most profitable decisions to you, my friends.
Thank you.